Hi, I'm Rachel Doenges. I'm one of the vets at Root and Riddle. I'm currently doing a residency for reproduction, so that will be all I do, and it's kind of my area of interest. I went to vet school at Mississippi State University, but love in Kentucky, and today I'm going to talk about some of your intact mares that are being used for other purposes besides breeding. Any mare that is intact, so still has a reproductive tract, may have issues that you kind of have to screen for and watch out for. The biggest thing we get calls about is vaginal discharge or vulvar discharge in mares. It's important to note that vulvar discharge in mares is never normal. We also do get calls saying that they think that they're in heat because they're seeing blood at the vulva. That is also not normal in a mare. So things we think about anytime we might be seeing vulvar discharge in a mare is we might have a uterine infection, we might have a vaginitis, we have other conditions like mucometra or pyometra, but the big thing is none of this is normal. We can see more issues develop in a mare that's done well throughout her life when she gets older because their conformation changes. As they lose some muscle mass or maybe even some weight, the reproductive tract tends to tip forward into the body cavity, so they're more likely to contaminate their uterus. They're also more likely to urine pull. The other thing we think about is vulvar conformation. Many of you know this from when people are determining if your mare needs a Caslix or not, which is when we sew the top part of the vulva down to the brim of the pelvis. Again, this can change as all the anatomy tilts forward. So you can have mares that have never had a Caslix in their life that need one when they get a little bit older. This not having Caslix can lead to wind sucking, so air going into the vulva, which can be very irritating. And a lot of people actually notice this when they're riding because the mare gets a little more agitated, and that's an easy fix. We can put that in, and we're good. The other part of the anatomy that tends to tip forward and cause problems is we can have their urethra go a little further over the brim of the pelvis and they can start urine pulling. And as you can imagine, any urine in the vagina can be very irritating. Unfortunately, if it's severe, we have to do more advanced procedures for that. It might require a surgery called a urethral extension. But again, the long and the short of it is, if you're seeing any vulvar discharge, it's an indication to get your vet out and get your mare looked at. Another thing we think about in any aging animal is an increased risk for neoplasia or tumors. Fortunately, in the horse and the mare, reproductive tumors are not that common, but the two major ones we think of are granulosa theca cell tumor of the ovary and then myeliomas of the uterus. A granulosa theca cell tumor, also known as a GCT, is a mass of the ovaries that does produce hormones. So a lot of times we see signs in our behavior. One of the most famous or well-known signs of GCT is stallion-like behavior. The reason for that is these masses can sometimes produce testosterone. But the reality is that is a sign only about 50% of the time. They only produce testosterone about 50% of the time. So if your mare is exhibiting stallion-like behavior, by all means, that is something to get checked out. That is not normal, but they can have one of these tumors without exhibiting stallion-like behavior. The most common sign of a GCT is irregular heat cycles. This is something we generally notice pretty quickly if we are tracking a mare cycle for breeding, but you might notice it because they seem like they're in heat all the time. Again, something to check out, and that can be a sign. Usually these tumors are curative with removal of the ovary, and the mare goes on and does fine. And in fact, even in the breeding animals, we can remove one of the ovaries and they go on to reproduce and do well. The other tumor I mentioned was a myelioma, which is the most common mass of the uterus. These are generally benign, so they don't spread. Rarely they can be malignant, so they would spread to other body parts, but it's very rare. The big thing with these are they're space-occupying tumors in the uterus, and they kind of can form a barrier for fluid clearance or a nidus for infection. Also, they can bleed sometimes. So again, this would present as discharge usually if you're not tracking the mare's reproductive cycles regularly. And back to, if you see discharge, it's time to get it checked out. The other thing we think of in mares is a lot of people associate behaviors with heat, and it's mainly objectionable behaviors with heat. And it's important anytime you see behaviors that you think are associated with heat that we determine if they're happening while they're in heat. So that would take a vet doing a reproductive exam and verifying that they are actually in heat when you're seeing the behaviors. Unfortunately, a lot of these mares that we think are having bad behavior secondary to heat are having bad behavior secondary to pain. So the recommendation is having a full lameness exam, and some vets even do a trial with some pain meds to see if it resolves the behavior. Another interesting thing that can have behavior that people commonly think is associated with heat is vaginitis, which is usually secondary to, or often secondary to wind sucking. And so again, it's a good reason to have your vet assess your mare's vulvar conformation and decide if a Caslix is necessary, because a little bit of wind sucking can be really irritating for the mare.